I'm actually here with Beverly, who is the patient that I was talking so fondly of earlier. And Beverly is actually the person that I was commenting back and forth with on YouTube, and she is my reason for making these videos and blogging. So tell them a little bit about yourself, Beverly. Where are you from? What's your name?
Beverly Bailey. I'm from North Carolina, actually. I used to live in Florida. Miss it a lot, but hey, back now.
So you travelled all the way from North Carolina to Florida. So why would you tell people that you would make that? Because that's quite a travel. How long does that take in a car?
10 or 11 hours, sometimes 12, depending on traffic.
And you travel all that way to come see us. What was the reason for that?
Because I had gone and spoken with several dentists. I actually was told that I had significant degeneration in my teeth and that I would have to have a bone scan done, and they would graft it and everything, and then I would have to go back once that healed, hopefully healed, and then they would have to put in the implants. Well, I couldn't handle that, so I researched and found someone who gave me some good information.
That's so cool. So you had been told by one dentist, or was it several?
Oh, it was several, but the one that I had made the actual appointment with was considering. He had set me up for the 3D scan, the imaging and everything, and he was wanting to set me up for the bone graft.
So you actually had an appointment made and were like on the cusp or the verge of about to go and proceed.
Right, and that's when I saw your post and I took the chance.
So you see why I decided to do videos is because of patients like this.
Yes.
Patients. You're not a human, you're a patient.
That's fine. That's fine.
So because I can sit here and talk all day long on YouTube and my channel about, you know, the procedure and how healing is and what it feels like, I've never had it done. I've had crowns, I've had fillings, I've had regular dental work. Try and explain to me, as far as like healing after the surgery, was it what you expected? How do you, like, just go through the process a little bit?
I had no idea what to expect. The healing time was pretty fast. I went back to work. Gosh, I think I took off a week and a half and went back to work. The main thing was having, you know, to let the swelling go down and, you know, my face and everything. And, but once that was done, it was all good.
And you can tell people, because I tell them, I was shocked. I mean, I've said it in my other videos, I don't know how I have a job. Because when I got hired, I was like, you can't do implants in a day. No. And then I saw these patients coming in at 7 a.m., leaving by 5. That is what you did, correct? I'm not making this up.
Absolutely.
Like, you legitimately walked in.
Yeah, I came in and everybody greeted me, and I mean, it was wham wham, get you in, get you comfortable, get you warm. It was awesome. And then I counted backwards and I was gone, and when I woke up it was like, wow. So
you walked out of there with fixed teeth?
Yes.
Didn't take them out?
No. Love it. Loved every moment of it.
Nothing covering the roof of your mouth?
Nothing. Absolutely nothing. And that was amazing, because for years I had had the dentures, and it was amazing. The taste, the everything, you know, it changes. Yeah, it changes. It's wonderful.
Why was it such an important thing for you to get done?
Because all across YouTube, I'm 50. I hated turning 50. That was the worst thing in my life. Yeah, she's 50. But anyway.
Gosh. 50's nothing. And
it was for me. No, it was for me.
Listen, if I look like this at 50, I'll be happy. It's on camera.
No, this child is beautiful. But anyway, it was a very hard birthday. I flew through 30, happy through 40. It was awesome, but 50 killed me. And there's nothing like wearing a denture and always being so scared that it's going to fall out. You can't have a conversation. You go to Busch Gardens and you're riding a roller coaster and you're scared to death. You know, it's going to...
Really?
Yeah.
See, but this is the things that because I can't talk about that. I can't ever sit and tell somebody, oh, you're going to be, this is going to solve that issue. So that was something that you actually had to deal with on a regular basis.
Every day.
Did you walk around wondering if people knew they were your real teeth or not? Or
I never had a concern with that. The only thing that concerned me was having to wear the adhesive and fearing that one day, speaking in public out loud to friends, it didn't matter, family for that matter, that it would fall, and that then everybody would be like, oh my God.
Oh, so that's really giving you a whole different level of confidence.
It really does. And it hurt. The dentures, got to the point to where they rubbed my gums raw, and because everything, I guess, in my mouth was askew, it almost one side was higher than the other as well, so. And
that's probably because of the bone loss, because you're losing bone at different levels, which I know, educationally speaking, that's normal. You've got something that's impacting that bone, whereas now the implants are going to preserve that bone that you have. And
that was a big plus for me, because they said all the research I did, and yes, I researched the heck out of this, said that the bone would actually hold to the implants and not pull away, like it normally.
Yeah, we can't, with implants, you can't put bone back. He did. He's put bone in there when he's done the implants to secure them. But as far as you losing bone, you're never going to have that problem anymore. One question that I got from somebody was actually, do you lose bone in between the implants? And I don't know if you know the answer, but no, you don't.
Awesome.
Yeah, that is stimulating the entire jaw. So I do know that you had zygoma implants,
yes,
which I will attach my video on the zygoma implants, because it's a very special type of implant specifically for people that have no bone, which is why when I heard her comment saying that she'd been doing research and there was nobody that could help her without bone grafting and a long drawn out process, I was like, no, yes, you can come in. So right now we're in December coming up, right? We're coming up in December. You had the surgery in August.
No, I came in August. I had it in September. Don't let me lie.
There we go. Yeah, you called me in the August.
Yeah.
We had the surgery. We had the surgery.
Yeah,
we had the surgery in the September, October, November. We're coming to the end of November, start December, and you just right as rain, like nothing.
Yeah, I came in for the follow up today, and it's like, yeah, baby.
And you are so different too. You're like a whole different person.
Confidence. It
when you
really makes a difference. It makes a total difference.
Because I remember meeting you one-on-one, and you literally were sat there just very shy. Probably because she never met me, and I'm a weirdo.
But I loved your personality. I don't know, it's hard. You get used to a lot of this, and you get used to putting your head down, or, when you grow up and you don't have good teeth, and then you're an adult, and it's even worse. And, having the dentures made a big difference to me, because I didn't have to worry about having the bad teeth showing or having missing teeth or anything else. But when you have dentures, it's still, I think this is the only time, and even when I got back from this, my friends at work had to call me out, because she was like, move your hand, your mouth is beautiful. But it's a matter of what you are so used to, and then
you realized you were doing it so much.
And then having someone call me out on it and say, no, you're beautiful, your teeth, your mouth, everything is beautiful, don't hide it. So I was like, wow.
And it is. Just give us a smile.
No.
Because I want to see it. Look, she said no. But look, you can't tell. You genuinely cannot tell.
Right.
And you don't have to worry anymore. Oh, is this going to come out? Is this going to slip? Do I have to wake up? Was that hard? Was that weird, waking up and not putting adhesive in?
Yeah. Well, no. It was
No.
harder than I wanted. It's awkward sometimes because I'll think about it. Because I used to go and I would take this extended bath just so I could soak my denture. My husband never saw me, never ever, without.
Talk about that a little bit for other women out there
Yeah.
that are in dentures, and not that it's a bad thing, because I don't think it's the dentures necessarily. I think
No.
if you've got really, really bad teeth, get the teeth out. And
Yeah.
I've said that in all of my videos. You don't have this stigma about dentures, but if you can or are willing to invest in something like this, it's totally worth it.
Right.
Because what were you saying? So you wouldn't ever let your husband see you without teeth?
Never. My kids have never seen me without. No one has ever seen me without my teeth. Never.
Wow.
It just makes you feel, well, of course, less attractive. I mean, you're so self-conscious. It's not funny. And yeah, no, you don't want your husband or your loved ones to see you looking that way. I mean, you really don't.
That's crazy. Because I've never experienced that, I would have never even thought that way. But then I guess it's kind of the same with anything that we put ourselves at fault for.
Yeah.
But now you don't even have to worry about it, and that's something that you.
I don't give it a second thought anymore, and it's the best thing.
Oh, and you look amazing! I love it. Okay, but what would you say to other people out there that are considering getting this done?
Don't hesitate. Do not hesitate, because in the long run, it will be worth it. I mean, everything about it. Your ability to smile, you don't hurt. You don't have to take it out. You can eat. You can eat corn on the cob. Do you understand that?
Is that something that was really
serious?
big for you?
Yeah. Well, no. Whatever you can't do it gets to you. If I grew up in the country. I always used to having corn on the cob.
See, you guys love my accent. I love her accent. Country.
No.
But corn on the cob was a big thing.
Yeah, I mean, just knowing, biting into an apple without the fear of when you bite in, your plate going boop, and girl, you just don't know. So, I mean,
I love it.
Heaven. It's really.
And now they're pretty, they're straight.
Yeah.
You don't have any work. Cleaning them, how's that so far?
Awesome.
It is?
Yeah, I mean.
That's what I tell people, but I want to hear it from you.
Yeah, I use the Clarisonic. Is it? Gosh, what is it?
Sonicare.
Yes,
Sonicare
Sonicare. Yes.
Yeah.
I use the Sonicare, and I just go like I would normally brush my teeth. I also go on the gums, though. I mean, and when you first get them, you have to be careful because it is sensitive. They are very tender, and
right.
If you're careful, you're fine. I mean, it works out great, and you put the toothpaste on it just like you would anything else, and you're good. I mean, it's
so cool. I love it. See, this is what I tell you in my videos, and I know it, but to hear it from somebody that's actually had it done, which I'm so thank you for coming and talking with me.
Thank you for asking.
It's just so much more reassuring that the information I'm relaying is correct.
Yes.
I can't tell you from my experience. I can only tell you from people like Bev that walk through these doors. And like she said, if you're thinking about it, don't hesitate. You need to call me or call one of us here, and we're going to take good care of you.
Absolutely.
Are you going to do some YouTube videos maybe?
Yes.
About your journey?
I think I'm going to start.
I think you should. And I will attach the link to Bev's channel in the video. Hopefully, I'm going to try anyway. If not, I'll get somebody to tell me.
We'll figure it out.
We'll figure it out. But I will attach it, and hopefully she'll start blogging, and we can start following Bev because she's only halfway through as well. You're in your temporary teeth.
Yes.
So if you've looked at what are dental implants in my videos, you know that there's a first set of teeth and a final set, which is super important because when you're healing, there is a gap that forms between the bridge and the gum.
Absolutely.
There is, correct?
Yeah, because it has to give your gums enough room because they're swollen, of course. When you first go in, they're swollen because you have the implants put in, and it has to have enough room so that it's not compressing in so it can heal.
Exactly. So a lot of places do teeth in a day, and they put teeth on, and then a few months later you're getting this gap. The additional thing that we do is the zirconia teeth, which I'm sure you're excited about.
Yes, I'm so excited. I can't wait.
Yep, and if she wants to make any changes to these, it's going to be a bit of a waiting game, but at least while you're waiting, you don't have to take anything in or out.
No, nothing out, and I can make notes. Whiter, brighter, longer, straighter, thinner.
I think they look
what?
Great anyway. I love them. I swear, I'm ready to start doing mine.
Yeah.
Just take them out and just give them
No.
Okay, well, thank you guys, and if you have any questions, leave them in the comments below. Make sure you subscribe. I will hopefully be talking to more people in the same situation. Literally 3 months out of surgery, sitting here in a chair, smiling with me.
Yes.
Literally a whole different person.
Yes.
And I don't see anything better than this.
Nope.
So feel free to give me a call, and I will attach all that information.